As we continue to focus on the coronavirus pandemic here on Eyewitness News at 9, we're also focusing on your concerns and questions about the virus. Dr. David Schultz with Evansville Primary Care joins me again tonight to answer many of your questions. Dr. Schultz, thanks for being with us tonight. First off tonight, let's talk about antibody testing. A viewer wants to know, what is that exactly and how much of that is taking place here?
Well, Brandon, antibody testing is very important because it checks in your blood to see if you have antibodies for the virus. If you're positive for antibodies, that means you've had a past infection. And so moving forward, when we get antibody testing available, we will be able to determine if you've had this infection in the past and simply did not know it. Now, the thing is about the antibody testing, it's not widely available yet. There are some initial studies being done for that. And so I would anticipate over the next 2, maybe 3 months, we should start seeing some of that antibody testing being performed here.
Are we seeing any success with using the plasma from someone who has recovered in someone who is infected with the virus?
So using some of the plasma that's recovered from someone who had a previous infection may be helpful because it can provide some passive immunity to that person and give them extra antibodies that can actually help fight off infection. But the data to determine whether this is an effective process or not is still yet to be obtained. It's still being studied. And in places where they are using this, it's being used as an effort to try to rescue someone who is not doing very well on their ventilatory services.
Okay. A viewer wants to know if they are taking Plaquenil for arthritis and have been doing so for years, can they still get COVID-19?
Well, Brandon, people on Plaquenil for other conditions can still get the COVID-19 viral infection. The purpose of Plaquenil is to help reduce those who have the virus from developing worsening respiratory symptoms. And so those are usually for people who are either very ill and cannot go to the hospital or already in the hospital and having worsening respiratory symptoms. Now, some studies indicate that using Plaquenil early may be helpful in cutting down the duration of the viral illness and also reducing the severity of the symptoms. But for right now, Plaquenil should not keep you from getting the infection. You're still at risk. And some may even argue maybe even at slightly higher risk because your immune system is slightly compromised to begin with.
Okay. Another viewer wants to know about medication refills. They're concerned about if they should be stocking up on their prescriptions, and is that even allowed?
Well, Brandon, we're not encouraging patients to stock up on prescriptions for fear that it may not be available. Right now, we have a very robust pharmaceutical industry in our country. We have good supplies of most major medicines, and in those areas where we do not have enough supply of a certain medication, there are other medications in that class that are available. So we would not recommend stocking up on medications. And the other issue with that is you still have to have a prescription for that, and most physicians would not encourage stocking up on medications.
Okay, good to know. Another question from a viewer: how long should we quarantine if we are exposed versus how long we should isolate if we're sick?
Well, for individuals who are exposed to COVID-19, we're recommending a period of time of about 14 days. And that's because symptoms can occur usually between 2 to 14 days after exposure. The median day, that is the day where you're most likely to see symptoms develop, is day number 4. Now, for individuals who are already COVID positive and have symptoms, it's usually a 7-day window after symptoms resolve that they should be considered COVID negative at that point. And we're recommending getting a blood test. Getting a repeat swab of the nasopharyngeal passage to make sure that that is cleared. And so we're recommending that after 7 days.
All right, a lot of great information again for us tonight. Dr. David Schultz with Evansville Primary Care, thanks for being with us again tonight.